Despite their post-COVID response shaming, the medical industrial complex continues to lean on crutches like flu shots and masking. Welcome to your Wednesday, January 14th, 2026 morning update. I almost never get tired of shaming these people. They never get tired of leaning on those old crutches. We reported last year or the year before an extensive study by the Cleveland Clinic, of all places, which proved among its 53,402 employees that those who did not get the flu shot had better outcomes. In fact, if you got vaccinated, you had a 30% greater probability of getting the flu. So if the goal is to not get the flu shot is probably not the best thing for you. And this also goes for masking. A local hospital has released a notice saying that its staff are all going to be wearing masks now because it's flu season, pretty much peak for flu. So yeah, a lot of people are going to get flu. It happens every year. It's not different or special. It's not climate change. It's not, well, masking isn't going to help. 2 years ago, St. George's Hospital did some research of their own, and they discovered that masking had absolutely no change in the infection rates for COVID-19, which of course was the beast. You know, it was the kraken of flus. They did nothing. We shared another study, a little bit different outcome. They say people who wore masks had a 40% chance increase of getting infected. And that can't just be COVID, because a virus is a virus. If you're wearing a mask and you're getting a flu shot, you are exponentially increasing the odds that you're going to get flu. Let's talk about that little alert a reader sent me. Dear patient, to support the health and safety of everyone in our care, Concord Hospital Health System, this is in New Hampshire, is updating our masking practices. Due to the increased prevalence of flu and other respiratory illness in our community, our clinical staff will now wear masks during all patient encounters. This precaution helps us reduce the spread of seasonal illness and protect our most vulnerable patients. No, it doesn't. This is medical health theater. It's counterproductive. It sends the wrong message. It creates a culture that creates more harm. Stop doing it. Masks will also be available at our entrances for any patient or visitor who would like to wear one for added protection. Masks are always at the entrance. Again, there's no evidence that it's added protection. At a minimum, it does nothing but block your airway. You know, and I'm not giving you medical advice. You do whatever the hell you want. I'm not your boss. I'm not your parent. I'm not your sugar daddy. You want to wear a mask? You wear a mask. Please, just do it. I don't recommend it. I'm not going to do it, and I'm not going to let anybody force me to do it. Thank you for your understanding and for helping us maintain a safe environment for all who rely on us. Sincerely, the Concord Hospital Health System. Again, none of this is true, not even moderately true. There's plenty of evidence suggesting that masks do absolutely nothing, and that the only reason surgeons ever wore them was so that they didn't accidentally spit or drool into the open cavities in which they were working. It's just become this thing that they do, and it doesn't really make a lot of medical sense. Again, I'm not giving you medical advice, but I am going to share some research that we posted a little while back. Certified industrial hygienist Stephen Petty's Senate testimony on why masks don't or can't work. And of course, my favorite, new research confirms medical face masks are toxic to humans. I'm going to read a little excerpt. It says 24 studies were included evaluating content and or release in 631 masks, 273 surgical, 228 textile, 130 were N95s. Most studies showed alarming results with high micro and nanoplastics. Release and exceedances could also be evidenced for volatile organic compounds. That included, by the way, PFASs, which the left loves to freak out about as forever chemicals. There's a lot of bad shit in those things. Again, not medical advice. You do what you want. But I'd stay away from them if I were you. That's it. Have a happy Wednesday. We'll talk to you tomorrow.